Hello, hello. We are live here at Innate Healthcare Institute. I'm Dr. Miriam, and we have got
Dr. Whitney.
our extraordinaire leader here, Dr. Whitney, with us, which is really exciting. And so, as you guys tune in, we are going to go over some updates. We have some exciting updates for the clinic. And so Dr. Whitney is going to go over those for us and update on what we're doing here and exciting information. If you're tuning in, I see some people starting to join.
Yeah.
Let us know.
Give them a few minutes.
Yeah, well, we can start. We can give them a few minutes before we tune in.
For the viewers, yeah. I mean, we always repurpose this and repost it.
Yeah.
So you can always watch it later. But
Yeah, we thank you for those who are tuning in. We were a couple minutes past the 12:15 today. The goal is 12:15.
Facebook Live is as straightforward as you think it is.
But we thank everybody who's coming. Let me see if I can actually look and see who's coming on. If anybody that's showing up, if you guys want to let us know in the comments, let us know where you're tuning in from. We'd love to know if you have questions. So we didn't get any questions at beforehand. So just a reminder, questions can go to info@innatehealthcare.org, or you can put them in the comments to this video. If you're watching this on replay, if you have questions, they can go there. And also, for those that are tuning in, if you have questions right now, like anything pressing that you want to ask us or that you tuned in for, please feel free to leave them in the comments and we will get to them as soon as we can.
We do get a lot of we do get questions, various questions on our innate support group. So in case nobody is, or if you haven't seen this is a Facebook group we have dedicated to our patients or even potential, patients or families that are coming there. Probably just Google in the group search innate autism stem cell families, and that should probably get you there. But that's a group to join where you can talk to other families that have been here, that have been coming to us for years, that are new to us. But there's lots of information posted on there. There's lots of questions from other families and parents that you can talk to.
Because we get that question often. We're doing consultations, like, can we talk to prospective parents? So this is a great place to go to connect and get insight, not just with one person, but maybe more families. And then also see what questions are asked.
It's almost impossible for us to just hand out everybody's phone number.
Yeah. No,
and say, hey,
good.
Sure, you can talk to this family or that family, and I get it. It's a big step to take, and to commit to.
Mm-hmm.
So you want to be as sure as possible, and you want to talk to everybody else. So we get it, but so that's a great, find that Facebook group, go on there, talk to other families that have been there. Myself, maybe Dr. Miriam and Pendleton will chime in on there sometimes.
Hi, Wendy. Thanks for tuning in. Anybody else that wants to, from Washington State?
I actually try to stay out of it a good bit.
Yeah.
I try to just let the families converse back and forth to each other on that group.
It's helpful. It's different when it's coming from families versus the providers, right?
Yeah.
But the business itself versus families.
So
yeah. So yeah, tune into that, and we'll put. You know what? Let me put here. What is the name of that group?
Innate Autism Stem Cell Families
group. Innate.
If I can put a link in there, I would.
Yeah, we'll see if Bruce can put a link afterwards. I wonder if at innate faith. Wait, stem cell.
If it would come up.
Yeah, I was gonna see if it would come up. No, but I did put it there.
Oh, we're live. We probably can't search for a group while live.
Well, it's like people. Yeah, maybe not. So anyways, that's there though. So it's in the comments now. If anybody wants to try and find that group, that's the one that you can look for, innate autism stem cell families. and you can connect with other families. I think that's a great way to get connected, ask questions, get the behind the scenes scoop. No kidding.
Yeah, it's so hard because it's such, you're coming from another state. You don't know what to expect. I know I saw one parent ask a question and another one had just come here and she was, she was like, yeah, they're in a nice building. It's a super nice facility. Other mom was like, oh, I was so worried that the place I was going to, just wasn't like a very good standard or something like that. She was kind of, I can't remember what she kind of looked forward, but yeah, it was kind of implying like she was going to go to a place like a strip mall and it was just like a rundown old place. And the other mom was like, no, it's a very nice facility.
We just
It
expanded.
is very up to date. Yeah. So actually part of our announcements today is our expansion of the clinic. We're at a 6,000 square foot facility now. So we basically doubled the size of our lab, of our treatment rooms, so that we can start adding more patients in,
Yep.
decreasing the wait time for families.
Yep.
We've got a whole department dedicated to autism now. So that's been a huge advancement.
Yeah.
So if you're new family coming in,
Yep.
they don't know where we started, only having, parents waiting for months and months and only having like 1 or 2 treatment rooms to treat the patients in. So now we have what? 4 dedicated
1, 2, 3, 4.
So that's big. Another big change we're making is consultations. So for years when we started, it was offering free consultations, free 15-minute consultations. Hardly any of them ever went 15 minutes. We've tried to provide more information in the form of our FAQs,
Yes.
YouTube content, but it's still really hard to make everybody happy and answer everybody's questions. So we're switching from a free consultation model because the doctors are booked. There's days where they easily could talk to 20 people a day.
Hit me if you let us.
Oh, yeah.
Thank gosh we don't let us.
If you actually kept it to 15 minutes. So we're switching to a paid consultation model. And we're going to try to provide a lot more information to you up front so that the families, the parents that know that they're coming for stem cells,
Yeah.
you're ready for a consultation, you're ready to move forward. This would be much more aligned for you.
Yeah. And on that note, let me just say, like, if you have scheduled a consultation with us, or if you plan to, do look in your email. I know our patient care coordinators always let people know, but look in your email for that FAQ. It is the most frequently asked questions, and you can tell when a parent has been able to take a look at it before they come to the conversation, and it guides our conversation a lot better, because when we're having a conversation, it's very open, like, well, just tell me what you do and what is it like and what are you using. When you read that FAQ, it gives you a lot more information and direction so that your questions can be very directed at like whatever thoughts you have around, your son or daughter or whatever concerns here, you understand the rest of it. And so then you can really make it like really about whatever other questions you have. So you've already gone through the basic stuff. So do look for that email.
Yeah, a lot of it, a lot of the 15-minute free consultations over the years has been very informative, but a lot of it is eaten up. It's just questions we can't continue to spend all day on the phone answering. Like, are you providing real stem cells? Are you a real clinic? Are you real doctors? Stuff like that. Those people, you need to go do your own research, and then when you're more comfortable, then come to us and schedule a consultation. But it's draining our resources and our energy and everything to spend 15 to 20 minutes with a lot of questions that are about legitimacy and stem cells and legality. And so it's like we can't keep doing that.
Common questions, and there's it's common thread right in our autism Facebook groups.
Yeah. We're way
we
past
clear about it, but yeah, we are.
We're probably the if I'm going to give a stamp of approval, this best in the biz in the States, like we're competitive with Panama and other places. So when you get time and time again of consultations of not even knowing what it is we do and what we are, despite a ton of information being out there, you got to call it quits somehow eventually. So that's another big change. So we're switching to a paid consultation model. What else? Oh, our prices. Another thing. We sat down, we dug into our pricing, and we kind of realized, especially on the bigger plans, like the patients coming and get a 1.2 soil cells or more. So the families that were coming here for a year, we kind of found out we really weren't making hardly any money at all.
Well, and then cost of goods, cost of all, as everything else has gone up. Go up quite.
And we hung in there. We really hung in there, and we didn't want to raise prices. Our goal, our ethos when we first started was to try to make this more affordable. You know, and to us, it's crazy. Families are flying all the way to Panama for one treatment at $23,000, whatever they're charging now, a treatment. So we're like, we can definitely do this better. So we really hung in there, but everything goes up. Everything goes up. Stem cell media went up a lot. And stem cell media, it's a liquid and stuff that you grow the stem cells in. So the nutrients and the supplements and stuff, what you culture a stem cell in, all has gone up pretty dramatically. So we hung in there. We increased our prices a little bit. Nothing too dramatic, but it's good to put that out there now.
Yeah, so we change pricing. Anybody that's in that is in the current pricing, you'll keep.
Right.
But anybody that's just signing up, like any other business, the minute you change pricing, anybody that still hasn't signed up, that's just part of the cost of everything going up, and that also keeps us being able to offer the standard of care that we do. Offering all of the service that we have, offering like even the testing we offer at wholesale. We don't mark up our testing. Any of our tests are wholesale cost, which is kind of unheard of in the business. That's where a lot of businesses make their money. And then we have our autism behavior specialists. We just have a lot of things that are and people that are involved in making sure that your guys' experience is the best possible. And so that's just something that goes with it. So the price increase is one. And then the expansion of our clinic has been the other.
Yeah.
And there was something else that we were talking about beforehand.
Labs you talked about.
Yeah, we talked about labs last time. I'm going to answer really quick. Wendy had a question on the proposal. So the proposal you should have received, we will double check on where the proposal is. Does it include how many treatments we suggest? Yes, it's the suggestion is typically 4. So 4 visits where you're coming to that 1.2 billion plan that we talked about. So 300 million is always our standard visit. That's how many you're getting, whether it's 2 days or 3 days, just depending on the weight of the kiddo. And so then 1.2 billion is 4 visits. The average time frame in between, I usually tell families, our only hard stop is 3 months. So nothing sooner than 3 months. Anything after is fine. And so I usually say the average is around 6 months, give or take. Maybe it's 4, maybe it's 8. It just depends on your schedule, our schedule, availability for you to come back again. But as long as it's over 3 months, that's all our hard stop.
Yeah.
So yeah,
it's like a happy medium.
It's a happy medium.
Yeah. We found out. We've had local people come monthly. We just had seen a very significant difference between if you got them monthly or if you got them like every 3 months, 4 or 5. The only plateau I seen that was more consistent was 6 months. It seemed waiting longer than 6 months, more parents tend to report a plateau or regression. Was what I had found at the time as to why we kind of narrowed it down to like every 3 months as being kind of like the happy sweet spot. Yeah. But yeah, good question, Wendy. Did we answer how long should we expect the proposal? Yeah. Will that include?
We'll double check on.
Our treatments we suggest. Yeah.
Yep.
So we have someone. My son has a cerebral folate disorder. We started leucovorin in September last year. He became more verbal since. He talks in sentences, however, he lacks receptive language. So when you ask him, how do you do in school today? He won't answer. But if you knock over his toys, he'll say, hey, why'd you do that? Why'd you so?
Okay.
She is curious if we see gains in receptive language after stem cell therapy. He's 4 years old.
We do. We see, I mean, again, we're going to go back to, we never guarantee an outcome. We know what the cells do. We know the cells are going to go in. They're going to start healing that foundational aspect of the body, of the cells, of communication, of inflammation, like whatever the cells are working on. So we know what it's doing. We don't know how you're going to see that on the outside. So do we see kids have those improvements? Absolutely. Part of that also is where Cece comes in, our behavior specialist. She was on our last live last week. So if you didn't catch that one, go back and take a look because she was on there. And so she was explaining, and we've talked about before how the cells are going to help your kiddo understand what it is that you are wanting them to do differently, or there is an aspect that the cells just help them in potentially understanding those things without even much behavior changes. But then the bigger things, and like learning, for any kiddo learning a new skill, there is the practice of that skill. And so that's where working with Cece will help you understand how to work with your kid specifically, different than a neurotypical child. But it still then requires the consistent, change that you're looking for, the consistent prompting in the way that you're looking for, like you were saying, ask him how he's doing at school. So it's like that consistent asking those questions so that they start understanding that you want them to answer differently, or answer in a more appropriate way. But the cells make it so that that's possible.
Yeah, the cells facilitate the neuronal connections to happen easier.
Yes.
Right.
Yeah. Yeah. So, but then it's just teaching kids things that kids need to learn that now they have the capacity that they didn't have before.
Yeah.
So that's the biggest difference. And so I like to really drive that behavior point home, because the cells do a ton, but like any kiddo, we still have to teach them behavior. And we both had young kids, and we get that.
Yeah. Mine is in the no phase currently. And oh my gosh. She is fiercely independent. So no, if the no is no, the no matter. Oof. Oh my gosh. All right. Let's see. Asma, she wants to know, I heard about this treatment is not FDA approved. Then why we will consider this treatment? I think she's saying, why should we consider this treatment? Please, I want to talk to parents who had done this treatment. Yeah, you're right. It's not FDA approved.
Mm-hmm.
There's lots of options that are FDA approved. There's lots of surgeries and drugs and stuff. So if that's your guiding light and beacon, then there's plenty of options for you to find FDA approved treatments. If you want to rephrase the question and say something like, are all FDA approved treatments the best option? I am very opinionated about that.
Answers no.
I don't think the FDA, all the FDA approved options are the best ones. But no, short and sweet. It's not an FDA approved treatment. It is experimental.
It is experimental. Yep. And so we definitely fall under that experimental category. But as with PANA, we've done tons and tons of procedures. So although it's considered experimental, does not mean it's not a research procedure. Does not mean that there is not care taken in how we grow following specific standards, and everything that we do following very specific standards. So, and those legalities, I believe that they are discussed on the FAQ as well.
There's a good legality section. Yeah. I think a lot of families get kind of a little worked up. Like, oh, well, there seems to be a group of people that are so heavily fixated on the legality part of it. And I don't understand why, but they're like, I can't, this isn't legal. First off, there isn't, and there never has been a law that outlaws stem cells.
The third-party sale is only one, right?
It's more so the FDA's intervention on selling commercialized biological products. And then it falls into this 351, 361 category. And currently what they're trying to do is kind of like, I don't know if this is going to change with the new administration, but they kind of almost see it as a drug. So if you're going to sell this drug with an intended purpose to treat a condition, you need to have the right, you need to go do clinical investigation and trial and stuff like that. So we're not claiming any of that. We're not intended drug with a purpose. This is a doctor-patient relationship where whether the patient already knows that that's what they want or not, you're talking to your doctor about, my child has autism. are diagnosed with autism. They have the here are symptoms. What would you recommend?
Yeah.
And this is what we do.
We recommend, yeah. Hello from Texas. Hello. Thank you for joining. Yes, you guys are scheduled in August. Awesome. Bring some swim trunks. I know that's gonna be hot as heck, but Texas is no different. Texas, you guys know heat. Quick question. Is it true that the kids should be guarded from any wounds, etc., after the infusion? Like, will the cells go to heal the wound rather than work on the underside, the underlying inflammation? Yeah. So, I mean, we don't tell you to safeguard your kids or even you're like take them out of school before because they might get sick. I mean, it's just life. If the cells are going to go where there is the greatest need for repair, if you will. So although our hard no is not hard no, but we highly advise against if your kiddo has like an active temperature that you come in, like an active fever that you come in and do cells. Have we had families do it? Yes, because they're already here, they're already in the middle of it. And cells are going to be used for that infection. That's just part of it. So as long as they understand that. So we recommend, like, if your kid gets sick right before you come and you can still change things, like change your visit. But if it's just like an upper respiratory, like common cold, runny nose, you're fine. If they have a small wound, you're fine.
Yeah, I think the probability of cells traveling to a wound is very minimal.
Yeah. It's like a very
depends on the administration method. We know that a lot of the cells IV, we see a lot of lung entrapment is what they call it. So a lot of the cells go to the lungs, and that's where they coordinate and modulate the immune system. So there tends to be this beautiful picture of cells going into the body, and we put them in an IV, and they're traveling everywhere like it's a freeway. But we see mixed results in the research with seeing a lot of entrapment in the lung, but what they're doing is secreting their biomolecules from there, and it's the biomolecules that are secreting out and going and communicating with the immune system and making the changes in the rest of the body. And then some propose that, a lot of cells are doing that, and then some are still going through the lungs and engrafting in other tissues. And that's where the chemotaxis, the traveling part comes in, where they pick up on the immune system and they home in the different parts. And then when you're doing an IM, their goal is kind of for them to stay in that tissue and secrete those exosomes and biomolecules. The intranasal route that we do is much more targeted for the brain. So if I did an IN on somebody and then they got a cut on their arm the next day, I don't think that cut's going to heal any faster than if they didn't get stem cells.
Right.
I wouldn't bet, unless you apply something locally.
Right. So yeah, I hope that answers your question. You don't have to pad your kid, put them in a bubble.
Don't bother your kid. Don't worry. If they get sick, the stem cells aren't wasted. If they have a fall or an accident, the stem cells aren't wasted.
Yeah. Yeah. It's a good question. Thank you for asking so that we could clarify that. I hope that answers your question. Let us know, anybody tuning in, if you have any other questions for us. We're happy to answer.
A technical one.
A technical one. All right. Perfect. Person for the technical question.
But you have to answer it.
I have to answer it.
I wanted to ask how many divisions the stem cells you harvest go through. I've seen some scientific evidence and theoretical concerns that after multiple divisions in MSCs, they may not function as well as their original. So I was hoping to get this info. How many cell divisions or passes?
We do 3 passes at our office. Yeah, we don't go beyond 3 passes. And it is my understanding that when those cell divisions happen and when you start to see actual changes to the cell, it is a large number of passes. Like, it's not within 1, 2, 3, I think even 5.
Yeah,
Very so much change.
Protein expression and viability of the cells. I think like 5 or 6. Some people say they mostly use that for research
when they get to that point.
Yeah, like research. Yeah, like you're testing the cells for something, and you don't need to see how well they perform necessarily, like in a clinical environment, but you're using the cells for something else. So you just care about how much they grow and divide. But for clinical applications, it's much more common to see somewhere between 2 or 3 passes. I've been told even 4 and 5 are not bad by stem cell biologists. But 3 seems to be a good happy medium. Be careful who you listen to out there. I had seen so many posts and social media stuff where now there's doctors out there saying, with no evidence, absolutely no evidence. I pressed some of them online to say, well, can you post a study? And the study they posted didn't have anything to do with what they were talking about. I won't call anybody out by name. But there's people that they're out there promoting that, if you multiply the stem cells at all, they're horrible for you. They lose their regenerative capabilities. I've even seen somebody say that they become more tumorigenic. So there is a higher chance of them causing tumors in the body. Ton of misinformation, no peer-reviewed evidence to back it up whatsoever. Straight off of a cord or even after one pass is still good, but there's a lot of splitting hairs when it comes to the marketing stuff and saying like, oh, we only do one pass. We are far superior to that. It's like, it's really not.
Well, and that comes with the outcomes that are not necessarily seen to be any different or better when parents go to both types of clinics. So we have parents that come from us.
They're charged a lot more for the 0 passes or the 1 pass, which, let's think practically about this, doesn't make any sense. Because if I need to culture cells from off of a cord to say P3, I need time. Biology, I need a lot of time. I need all the stem cell culture in media and the growth factors and the supplements you put in. Gases, the gases that go into the incubator.
All the material.
So much stuff would possibly make a P3 way more expensive than a P0 or P1. However, conveniently, when a couple of clinics that are promoting this do that, they charge way, way, way higher because these cells are better, they say, and it's harder to grow them, so they need to charge more from it.
Yeah. And just know that we get, and it's not about like who's better or worse. It's just about like informing you about some of the tactics that can be used and also can be used to try and say that, hey, somebody else is, we're not doing it good enough because ours is 3 passes. The cells don't work well enough. That's not true. And also to understand that we have parents that come to us from all over the world, of not only all over the world, but having gone to a lot of other clinics and come to us. And it's not, none of them are saying like, oh, our results were exponentially better when we went to this clinic that had 1 pass versus what we're seeing with you guys. I think actually our advantage is in the decision to use the multiple different ways of infusing the cells and working, on the behaviors and looking at the toxins. The fact that we do all those things, kind of that 3-part approach, that gives us the best outcomes. And that's not just from our mouths. That's from parents that come see us.
Yeah.
So lots of things just to be aware of, right? So do your homework, see what's out there, but just be aware of some of the things that are being used as tactics just to keep you in a certain place. Hope that's helpful.
Yeah, it's getting harder and harder to do their homework. There's so much misinformation out there.
And they've been explaining to you stem cells that are just using not live biologic.
Not live, yeah. So they'll label it as stem cell, but it's a biological product and it has minimal to none to no.
So how would you say they can do a better job of understanding when that's real versus not?
So I would press, I'd press the clinic, let's just say it's a clinic, on certain questions, like you say you're providing stem cells. Are these live stem cells? What is the source of the stem cells? Yeah, they're live. They're umbilical cord. We get them from Wharton's jelly. Most places use Wharton's jelly. Okay. What's the dose? What's the amount that you're administering?
And you want the number of cells and not milliliters.
You do want the number of cells, preferably. That's the dose that even International Society for Cell and Gene Therapy and in places, that's the dose. That's what we use as a dose, kind of like aspirin, 200 milligrams of aspirin or a drug. That's the dose that we use. When you give a volume, we can put 100 million cells into 3 milliliters. I could put 10 into 3 milliliters. So the volume doesn't tell you really what you're getting. It's telling you an amount of liquid. And a lot of places, a lot of clinics will say, we give you 5 cc's. It's just medical talk for like 5 milliliters. Yeah. We'll give you 5 cc's of stem cells. Like, okay, well, I want a number. How many cells am I getting? A lot of times you'll get 20, 30 million cells. Now ask, are these mesenchymal stem cells? You said I'm getting 30 million cells, or how many cells? Are these mesenchymal stem cells? Are these characterized? Are they CD390, CD73, CD105 positive? Are these CD34 negative? Are these live characterized stem cells? Because what I noticed way back in the day was sales reps from biological products would say, yeah, you're getting 20 million cells. And they would report these in CFUs, colony forming units, or they could have been any kind of cell type. It could have been a fibroblast. It could have been a white blood cell. So they'll say, oh yeah, well, most of the time they say this to the doctors. So the doctors don't know any better. So they'll just go translate it to the patients. They'll say, in our product is 30 million cells in each one of these bios that we're selling you. And the doctor may not know better. Oh, okay. Well, so patient, you're going to get 30 million stem cells. And there's so much loss in translation between that. So the number of cells, if they're live characterized mesenchymal stem cells, that's why we got in the habit of spinning the cells and showing every patient that came in here. Yep. This is what 100 million cells looks like. You should be able to see a pellet of cells. Throwing them under the microscope.
Yeah, for those that want it, you can do something called viability testing just to show you under the microscope how many are still live and viable. Anything over 85% is good. We are regularly 95% or above.
So asking for flow cytometry, reports, yes. Asking for sterility testing is something we'll send our patients and say, look, yeah, we ran we ran these reports. You kind of got to know what you're looking for, which they did tough. I could send a scatter plot, and he's like,
yeah, I mean, it won't make much sense, but I think that is really good information, just knowing that the cells and knowing how they kind of can come about, telling you if they have something they actually don't, because
hopefully ethically that you should be able to ask a place, well, are these live mesenchymal stem cells, or is this a commercially provided biological product? Did you buy this from a third-party lab or something? And
yeah, hopefully, yeah. So hope it out. But yeah, I think we're at our time. Is there anything else that you wanted to say?
How far do we go? 30 minutes or something?
Yeah.
Oh, okay.
Yeah.
No. I usually give 1 hour talks.
Oh. Well, we could.
My YouTube videos are 30 minutes at least, and I gotta try to shut up and not talk. But I think that's good. Thanks for the great questions.
Yeah, thanks to those who tuned in. We appreciate your questions.
Sorry if any of the ones that.
Yeah, and let us know, if there's something that was really on your mind or that came up after what we talked about and you want, you have greater questions on it. Let us know. We're happy to answer questions.
It's 3:00. You want to talk about the 3:00?
What's the 3:00?
Adding numbers.
That's up to you.
We are trying to get more patients in. We realize that
But our
happy and you want to come now or in a month or something, but you have to wait a few months. So we are going to start adding another time slot in to treat patients that should bring down the wait time
a bit. Yeah,
a bit.
Mm-hmm.
Not having the doctor's schedules flooded with a bunch of free 15-minute consultations should free up time to have more treatments and lab reviews and stuff. Yeah. More doctoring, essentially.
More doctoring.
So
Yeah.
Yes, there is a possibility of getting in sooner.
Yeah, and if you're not already on the wait list is another good way when people when they have cancellations or when we have cancellations. People cancel, have emergencies, whatever. We go straight down our cancellation list. So we've seen people at like the bottom of the list come to the very top because they could make it in such short notice. So make sure you're on the cancellation list. If you can make in short notice and you want to try and get in sooner, that is the next best way outside of us moving appointments or having more availability coming soon.
And Dr. Miriam has offered to work Monday through Sunday, 12 to 14-hour days.
Absolutely.
Can we get a commitment right now?
A live commitment that she is not going to do that. Hey, all you all heard that. She is not. No.
Yeah, we are working. Everyone's working really hard. Y'all have no idea how much they work to do stuff and try to provide the best care, because it takes time and it takes energy and stuff to do that, and not shortchange anybody by cutting anybody short and hurrying up.
Yeah.
And hurrying up and getting people in, you can handle in and stuff. So.
Yeah, it's a fine line and wanting to give you guys the best care and also wanting to make sure we can see more people because there are so many that are wanting to come in, which, we're happy we're here.
That's a really good one. Alexandra, yes, we are working on, I'm a bit picky on pictures and videos and stuff like that. I just want it to be done so good. So yeah, we're kind of working with a videographer to have, we have some new equipment and new, what do you call it? Furniture, basically. We remodeled. I didn't. They remodeled. And it looks a lot better. Since we have this, we added another 3,000 square foot for the autism department.
Yeah.
So yes, well, when we get pretty, we get it nice.
We have
pretty.
We have some things that we're just finalizing, getting proper decor and furniture and all those things.
But yeah,
part of us all the expansion.
I love that idea. It's been cooking in my head for a while. Just have like a walkthrough, kind of like what a day looks like. To go through the stem cells,
you meet,
preparing them, and yeah. Okay, well, thank you.
All right, thanks, guys. Thanks, Dr. Whitney.
Yeah,
see you next Tuesday, 12 to 12:15 Arizona time. So we're 3 hours difference from East Coast, and we look forward to seeing you guys here. Bye.
Bye.